All right. Looks like we are all here. It is 2:03 in the afternoon on May 12th, and I will call to order the Budget Committee meeting for YCOM. We do have a couple of new members this year that are either taking the place of folks who are have moved on or are now in those seats. So we have Mayor King from Amity.
Yeah.
You were here last year.
Mm-hmm.
Gonna go through the list.
Chief Wood from McMinnville Police. And we have Amanda Christensen from Amity. And Chief Phil Riggs from Sheridan Fire, who I didn't mention. Amanda is taking Tom Scheibel's position, and then Chief Riggs is taking Chief Thomas's position. So we do have Chief Godfrey and City Administrator Dross online. So
Welcome, new members to the Budget Committee.
we will launch into the agenda. The first item is the Budget Committee Chair for this year. I would, I guess, ask Brandon Dross if you have any comments. You were the Budget Committee Chair last year. And then we will have to select who will be the chair for the Budget Committee this year.
Yes. I know I wasn't last year, but last year I was in person. I would hate if anybody were to nominate me, and I'm virtual. I don't feel I can run a meeting effectively being virtual.
All right. Obviously, this is a little different than a regular executive board meeting because we are just here about the budget. But are there any discussion topics or nominations for anyone to serve as the Budget Committee Chair?
I would like to nominate Mayor King, if she would like to, just because she knows how to run a meeting and she's been effective at it.
All right.
Would anyone else like the opportunity? Okay, if not, I will accept.
So we have a nomination for Mayor King. Any others or any discussion?
I think you would need a second, and I'll second it.
We have a second from Commissioner King. Any further discussion? All in favor of Mayor King serving as the Budget Committee Chair, say aye.
Aye.
Any opposed? Nay. We have a unanimous vote for Mayor King to serve as our Budget Committee Chair. As the Executive Board Chair, you have the agenda, so we'll just be turning it over to the director to give us the presentation on the budget for 26-27.
And for the folks online, the little green button here, make sure you talk into the mic. They won't be able to hear you.
Patty, if you want to go ahead and give the presentation.
Okay. Thank you, everyone, for taking the time to attend today. First, the first document that I will be speaking from, it looks like this on the front. It's a splash page to YCOM's website, www.ycom911.gov. And it is the director's budget message. And following that, I will be referring most of the time to a document that is entitled YCOM Fiscal Year 26-27 Budget Scenarios. A couple notes for you right off the bat is for the last several years, I have sent this document that we're starting with out the week prior. While it doesn't give you specific numbers, you would be walking into the meeting knowing what I'm going to present or where my mind is. The schedule being what it was this year, I had the first opportunity to meet with my budget officer on Friday and came back and made adjustments to my budget so that we fulfilled the time frame that was required for noticing. And then I worked on finishing up or adapting my budget message. So my apologies, my budget message, this document was not ready for you until late last night. So I will continue striving to get that out a week earlier. That said, I will tell you there's nothing in this document that has not been spoken about for the entire last year. We ended last year's presentation with myself urging a recommendation that the board and the budget committee take up conversations as the year continued about the growth and the fiscal responsibilities and the capabilities of the organization to be able to continue for future years, and those have taken place. So there shouldn't be anything that is a surprise here, other than unless you're laying bets on what I'm going to recommend. So we'll go ahead and get started. Are there any questions to begin? The only other note that I had is that Ken Huffer, so I do consult with him. Member Dross had asked me if I wanted to serve as YCOM's budget officers on my own the last time that our board met. And I said, I really appreciate his years of financial expertise, budget process, and the governance of the budget, and being able to ask him when I move money, or am I allowed to do this, or what is the impact of that? And I did not want to discontinue that. So I do feel like all of my questions were answered, and that I'm presenting a budget in line with what he approved when we met. Any questions there? Okay. So just starting with the first page, it's the only one that isn't numbered, the splash page to YCOM's website. I just want to let you know that and point out right in the middle of the page, underneath the About YCOM, you'll see Executive Board of Directors. And we received some feedback from the public within the last few months that it is hard to find some of our meetings and some of the materials with the meetings on our website. And recognizing that that is a drop down that you have to hover over the About YCOM to get to that. It's just the capacity of our website. So I want to let you know in response to that, and wanting to be more readily available, we posted the budget on the splash page, as well as budget notice underneath the Executive Board of Directors, the meeting calendar, and the link for this meeting. And we do have plans to review and possibly do some design changes over the next year, knowing now that we are starting to see some interaction from the public. So I'm pretty excited about that. So along with that, underneath that, we do post the calendar, the annual meeting calendar in February when it's adopted by the board. It has a hyperlink at the top that shows all the list of meetings. We have placeholders of meetings as the next meeting approaches. Add the agenda and the Zoom link as those are available for the meeting. And finally, one other change that we made this year, we used to remove it after the meeting and then go with the next meeting. And so now we're looking more to that historical. So April is still there with a link that doesn't work anymore. However, the agenda and any handouts or documents will stay with that. So I'm excited to do that. And like I said, this is really the first in the years that I've been the executive director, the public has started looking for us online. Typically, I am the face of the sheriff's office, the police department, Amity Fire. When they call, they're looking for an entity, not for YCOM. So, okay, moving into page 1, the budget message. I made a change on page 1 for those repeat committee members. This looks familiar to you. The main change that I made is on the left-hand side. I'm now went back to listing the 190 member entities. We used to have a list of all of our 190 members, and then this document became operationally focused and went to the agencies that provide the services for those members. And with our 190, all of our conversations, I thought it was important to show there's 17 member entities that make up our 190. They are listed here. The break that you see reflects the top list of entities. You're going to see 9 police members who are served by 4 police agencies. So 9 police members are providing the 80% funds in the member dues schedule. And then there's a gap, and then the next list starts with the Amity Fire District. These are our fire members, and you have 8 member agencies represented by actually 11 entities. So a difference there, and the difference being Chief Riggs, his member organization, Sheridan Fire District, has a fire district and an ambulance service area combined. So YCOM, when you look up above and it says provides emergency 911 call answering, dispatch, and non-emergency services to its members through 4 public safety law enforcement, 8 fire districts, and 3 ambulance service areas. That's why those numbers don't match. They're not supposed to. But when we look at our dues schedule later on, as far as our budget, you have 9 members that are contributing into the police dues, and you have 8 member agencies that will be contributing into the 20% fire dues. Are there any questions there? Okay. And I don't plan to read any section word for word unless there is some type of focus on there. And I will stop at the end of each page to see if there is anything you'd like me to cover. Does that sound okay? Okay. Okay, on to page 2. So this is data that you have seen year over year and just in a little bit different format. So in February of every year, this year, I think it happened in April, though, I briefed the board on statistical data of the performance of the agency in the year prior. And we are a primary public safety answering point, and we process a lot of telephone calls for an agency our size. In 2025, YCOM processed 116,044 telephone calls. This includes all telephone calls from emergency 911 calls, which you'll see over on the right-hand side. There were just over 26,000 of those. And administrative lines, so that's our 434-6500 line. We processed 89,737 non-emergency or business type calls received on those administrative lines or placed. And this is the first time that I've actually the graph caused my attention to focus on, I've always denoted the outbound, but the software that I used to create this draft also denotes that our outbound calls are 26.7% of our total administrative call volume. And that's something that I hadn't looked to capture before. Okay, as far as 911 emergency response times, so we are still tracking and reporting out industry standard is that all 911 calls will be answered within the first 10 seconds, 90% of the time, and within the first 15 seconds, 95% of the time. And YCOM continues to exceed those standards, 97.59% of the time within 10 seconds, and the remaining calls are answered 98% of the time, 98.89% within 15 seconds. Pause there. Are there any questions there? Okay. As far as computer-aided dispatch, so the work that we do. So what do we do with those phone calls? Out of over 116,000 phone calls, a dispatcher created a record in the computer 96,455 times. And actually, it was well over 100,000. I won't say they're one-to-one. Actually, I think there's even more than that because we initiate some from the radio, not from the telephone. But that turned into an incident, which means a call for service that a member agency responded to. And in order to get that, the computerized record had a validated address, so a location. It had a problem code, so a call type. It had a unit assigned to it, and then a timestamp that the unit actually went en route. Now, on a traffic stop, do they go en route? Well, they call out the traffic stop, and the way we input that into the computer, they get it dispatched in en route and an on-scene time that is exact to the 100th of the second. So yes, they do. So that's what constitutes a master incident. This is something then, a record that we are tracking in our center. It's center activity, 96,455 times for all entities, police, fire, and EMS. And then breaking that down, I say 79,795 unique events. What's the difference in those two numbers? One may be a traffic accident. So traffic accident is a unique event, but we have multiple disciplines, police, fire, EMS, going to a traffic accident. So in the $79,000 number, we're counting individual things that occurred. Okay, cumulative quality assurance. So I'm going to talk in a few minutes about a new capability that YCOM has, but the graph that you're looking at here, the display that you're looking at here is our traditional agency quality assurance. These are hand evaluations that are done by both Dispatch Supervisor Darcy Anklade and Operations Manager Steve Long. Law enforcement, again, we have an 85% compliance requirement industry-wise for law enforcement and fire dispatch. And you can see that in 2025, YCOM continued to exceed those industry standards. Law enforcement dispatch compliance was 98.3%, fire was 99.3%, and emergency medical dispatch, that goes on a scale of 0 to 10 with our compliance. So we do have an emergency medical dispatch protocols through the International Academies of Emergency Dispatch. It is a software program that we use. We used to use flip cards. It's a software program called ProQA. They are medical dispatch programs, and each dispatcher has to be certified in the use of those. Our use of that system provides us with liability protections if we remain in compliance on calls and we are sued. We do receive liability protections from the International Academies of Emergency Dispatch. All of our training and certification is through them as well as they can provide us with industry standards and metrics. The quality assurance program that we use to hand create and hand complete these evaluations is called Aqua, and it is a separate software also that Darcy uses. She is our compliance coordinator at YCOM, and she performs so many per month per dispatcher. It's actually our minimum requirement is 3 for EMD calls only, which you go, I saw that looking right. 3 for emergency medical calls. She did 24 for our organization in the month of March. And in addition to those, we have long talked about allocating work out to some of our lead dispatchers for audio requests from the DA's office or from member agencies. We have held back that task because only Steve or Darcy or I complete those. And we are listening to everyone as we record those to see if that needs to be routed through our evaluation system as well as our practice is any type of event with catastrophic loss, any type of medical call with high acuity. Darcy is also evaluating those. They are not random evaluation. So to give you an idea, and especially as I am excited to talk about a new capability that we've added, it can't be a replacement because this is what keeps our certification and our liability protections. But last year, she completed just under 1,000 EMD evaluations. In contrast, a new tool I'm going to talk about has year-to-date through artificial intelligence has completed evaluations on over 10,000 of YCOM's calls. So we are using it as a supplement. Are there any questions there? Sorry, I keep taking these on and off.
I had a quick question for you.
Yes, sir.
Newburgh is not part of that 116,000,
Correct.
correct? So it's about 1.4 calls per person in Yamhill County. Is that a normal number for county our size or a system our size?
Yeah, this number is down just a little bit from, I think we've had some years in like 128,000, but yeah.
But that's, you said that this is a large number for a county our size, or for a system our size.
Not a county our size, for a center our size.
Sorry.
The workload that our staff performs. So in contrast, the Woodburn Dispatch Center, they're called MetCom. Last year, they processed 33 or 30, actually, I think it was 39,000 911 calls. They have a staffing complement of 19 dispatchers, 5 administrators, and 3 part-timers. YCOM has 11 dispatchers, 1 supervisor, and 4 administrators. So we have done some studying on staff size equating to call volume, equating to calls of service for our member agencies. And we are considered a medium-sized center. That's what Oregon Department of Emergency Management would call us. MetCom, I use them as an example. They are a comparator for collective bargaining. Yes. Okay, on to page 3. So this is when we get into the fiscal messaging of the organization. So in fiscal year 25-26, the budget provided for numerous projects as well as supporting the service to our member agencies. One of the things that we've been tracking for many years is the American Heart Association's target for a patient receiving the first hands-on chest compression in under their recommended 120 seconds on all incidents of sudden cardiac arrest. And what this page is highlighting for you is over the course of 30 sudden cardiac arrest events that YCOM handled last year, and these are non-barrier cases, meaning the patient, they were able to get to them. So in 30 cases, YCOM was recognized in a ceremony that McMinnville Fire District places every year for 6 different stays that ambulance service area celebrated for 2025, where the chain of survival was enacted. The first 3 of those, so that's on the bottom on the right, the 6 links to adult out of hospital chain of survival. So this is before the ambulance gets there. What can we do to intervene and influence the survivability of sudden cardiac arrest, the recognition of the cardiac arrest, the activation of the emergency response system, the instructions for early CPR, the early chest compressions and rapid defibrillation. Those all happen within the center while our responders are traveling too. And they're the first 3 core parts of the chain of survival. And so in the recognition ceremony, we had 6 different members of our staff that were celebrated along with other first responders for rendering that early intervention that eventually concluded with the patients receiving life-saving care and leaving the hospital successfully. So over on the right, there's a picture of 4 of my 6 staff who attended the ceremony. And just of note, Madison Varell up there on the top on the left, she actually was involved in 3 of the 6 life-saving calls for McMinnville. Angie Eichler down in the bottom left, you see her in both of those panels. She was also involved in 3 of the 6 life-saving calls. And Kayla Slate, she's the second one in from the right, on the right-hand side of the page. She was involved in 2 of them. And I think last year she was involved in 2 or 4 of them. So we are very excited to receive the invitation and have our dispatchers recognized. And then not pictured here were Talia Quillen and Josh Whitrock, who were also involved in these CPR saves. So it is also important to call out that just like we are doing things before the ambulance gets there, there are other YCOM members that are as well, and that's law enforcement and the first responder agencies. So the agencies that David represents who don't have an ambulance service area, they're going as early and often are first on scene, delivering the defibrillation before the ambulance gets there. And then the ambulance continues that care and on to the hospital. Also in this particular ceremony, I know that Carlton Police Department and Yamhill County Sheriff's Office were also recognized for their actions that they took. Are there any questions there? Yeah. Moving into page 5. Also, as an active project in fiscal year 25.
Sorry to interrupt. I have a quick question. Or
Yes.
do we have someone that's checking if there's questions online when you
Oh,
ask us?
Thank you.
Okay, I just wanted to make sure. Thank you.
Thank you. So over on the left-hand side, I have 2 pictures for you, and they're highlighting marketing that we will be doing to the public for our integrated text to 911. So the board is aware that that project has all but wrapped up. We do have the 4 major cellular carriers on board. They are tested, they are live. Text to 911 is turned up at YCOM. Why has that not been announced to the public? We've done considerable amount of testing. It has been my intention the second week of April, which is past, during National Public Safety Telecommunications Week, we would celebrate that and we would launch a social media campaign to let our public know that Text 911 is available in their area. That has been a bandwidth issue for YCOM. So these are placeholders. These are graphics that Darcy Anclade has created in preparation for us to provide these to our member agencies and ask them to help us get the word out on social media. And for you and for all that are listening, the message has always been and will continue to be to call if you can't, text if you can. There are absolutely business cases and real needs for people to be able to text in lieu of placing a voice call to 911. But we need to ensure that the public understands that the voice call to 911 gets them the quickest response in the fastest manner. And that simply is, I just said a lot of words very quickly versus picking up my phone and texting them to you. So we will be launching that right now, the adjusted schedule is next week. We have a user group meeting next Tuesday. We want to provide the files to our members and the plan. And that means that we also have primed our dispatchers. We had a staff meeting and gave them a heads up that we will be launching it. And we have been told by other centers in Oregon who are live with integrated text 911 that they get a rush or an onslaught of text calls or texting sessions to begin with. And after a few months, it dies down. So because everybody wants to try it out. And is this really real? I can tell you, if you pick up your phone right now and you punch in your messages 911 and say, is this working? Your texting session will go to YCOM. So unless you have an obscure cell phone company who has not contacted me. So just for committee members, we file paperwork with the FCC. They receive it. I notify all of the major carriers in the United States that we are live with the capability or we are accepting. Each one reaches out. They do testing sessions with us and we sign off on the fact that their texts are coming in and they're receiving them and we can back and forth converse. Any questions? Okay. Is this all right speed? There's a lot to cover, so, okay. All right. I also note we have concluded a project that was hosted by the Confederated Tribes of Grand Ronde Fire, or of their emergency services, and that is a USDD G2 fire station alerting. So when they built their new station on McPherson Road in Grand Ronde, they implemented all types of new and variety of notification mediums throughout their station. Tickers that show the location or have the ability to show the location of the call. Sleeping rooms that I'm assigned to ambulance 1, and member David is assigned to ambulance 2, and my ambulance gets dispatched and my lights come on and there's an audible tone and strobe lights that flash, and I wake up and he sleeps in the room next to me because it's not his unit. Things that might turn off a television, interrupt a television, turn off stoves, open up doors, all kinds of different things. And in order to, so also we have several members that have station alertings, and the station alerting primarily occurs by RF tone. So we send tone pages, and they receive those in their station. And there's RF equipment that says, oh, that's for us. So I'm going to turn on the lights. I'm going to open up the door, or something like this. This is advanced notification. It required a virtual private network that the tribe had to spin up and then connect back to YCOM. This provides them with the same type of call for service data that we send to our members for digital paging. So we're sending the location of the call, the type of call, the units that are assigned to the call. And then there's hardware in the station that is separate from YCOM, paid for by the Confederated Tribes, that manages what they do. They receive that call information, and that call means, and that unit means I turn on a light, I wake up Patty, not David, et cetera. We do expect there's been a lot of talk at the Fire Defense Board level, which many of our members are, actually all of our members are members of that group as well. And we do know that we have other members who want to come on to that. So that hosted technology, the calls for service interface is a Central Square product, is part of the public safety suite, and I am that customer of record. YCOM is owning the public safety suite. So the hosted technology line has a corresponding revenue line. When we get into the lines of the budget, I will point those out for you. The corresponding revenue line allows for me to receive repayment from the Confederated Tribes for that interface. I am billed by Central Square, and our budget provided the dollars on both of the expense and revenue side last year. You will see a repeat of that for other hosted technology and known projects for fiscal year 26-27. Are there any questions on that? Okay. So our new capability, super, super excited. And we've been, Steve and I have been briefing the board for many months. Steve Long, our operations manager, went to the Oregon Department of Emergency Management. We applied for a variance for the 911 sub-account funds. So that means something that normally would not be funded by the 911 program. He made a case, he applied for a variance, and we acquired a new capability that was paid for by the 911 program. It's paid for by the 911 tax, but it doesn't take away anything from the 911 distribution. It's out of the 35% of the distribution that is brought in. It's a company called GovWorks, and the product is called Comms Coach. We're using Comms Coach evaluations and also simulations. We've completely implemented it in our training program. So I can go to the computer and tell the computer to create a call taking simulation of a fire with someone trapped inside and a caller who doesn't want to listen. And a voice will interact on the computer with our dispatcher. We can ask them, our trainees can ask them questions. It will respond. It will tell us that there's people in the house. And the dispatcher can go through a live per se, simulation utilizing our agency equipment to create a call for service, and then immediately receive feedback on their performance and keep tweaking it and tweaking it. We can send out training to our dispatchers. So all of our career staff will be going through fire season and marine season training. We do every single year. We're going to utilize comms coach simulations for that, for drownings, for stranded boaters, for wildfires that have exposures, to high acuity calls. What's a high acuity call on the fire side? A plane crash. They don't happen every day. When they happen, they're always bad. They very, very rarely are not bad. So I have dispatchers on staff who've never worked a train or an airplane crash. I work several of them. I dispatched in the years that the Flying M airstrip was open, and they had several at different times, and also the Sheridan Airport was open. So I have several of those stories, and I have dispatchers that have been there 16 years that may have never worked a plane crash. Same thing with pregnancy, childbirth calls, MCIs, hazardous spills, all of those kind of things. So we're super excited about that. And with your handouts today, and Emily also emailed them out this morning, I gave you 3 examples of evaluations that the artificial intelligence of Comms Coach. This was a project that Darcy and Stephen worked on. They still work on. They have at least 1 weekly call with GovWorks. And we have been teaching the computer, the artificial intelligence piece, what our criteria are for successful calls. So one of the things right now you'll see in our scoring, so I had told you that as of last week, so from January 1st to April 30th, Comms Coach evaluations did 8,849 evaluations of calls that our dispatchers took. These are real calls that our members responded to. And overall, as an organization, the compliance score was 95.74%. And my excitement, I just briefed you in the opener, our traditional quality assurance program, we did about 1,100 calls for the DA's office last year that would have been evaluated. She did 700 EMD calls. I would tell you well under 2,500 calls for the entire year of 2025. Sampling did we have in quality assurance. And right now, the system has done over 10,000 of them. So what happens to these? The only thing is, as managers, as leaders, we need to be mindful that it has already done these, and I haven't looked at 10,000 of them. Steve has not looked at 10,000 of them. So also built into the product is criteria for emailing both Steve and Darcy and highlighting things that need to be looked at. 100% scores and scores that don't meet the standard, the 85%, or they can also set, if they don't ask about a weapon, maybe the overall call score was a 92%, but it was a critical failure that they didn't ask about a weapon. There's all kinds of things that we are still just getting into. So in comparison to the 24 emergency medical dispatch calls that Darcy has QA'd for March that I just reported out to you, Comms Coach in March evaluated 48 fire call taking, or did 48 fire call taking evaluations. Overall, we scored a 91.34. Comms Coach did 797 evaluations of medical calls. Overall, we scored a 97.69. And Comms Coach did 65 evaluations on customer service skills by dispatchers only. And then 1,466 evaluations for law enforcement call taking, and we scored a 95.71%. So even though 797 medical calls cannot be attached to our International Academies of Emergency Dispatch, we most certainly do have a better picture of what the performance of the agency is. And what they've done is went in and aligned all of what comms coach is evaluating to our evaluation and scoring that they do by hand. And we're going to continue doing those at least for the foreseeable year so that we really have a side-by-side comparison. So Darcy can evaluate an echo level breathing problem, and then she can go in and say, what did comms coach do with the echo level breathing problem, and compare to ensure that we are providing the feedback necessary to our staff for performance. Questions there?
Yeah. So is the $35,000 increase, is that on the line item? Is that for this in
Yes.
its entirety?
And so I will point that out. It's in professional services. So GovWorks, the cost of this product it's an annual subscription, was $56,000. And when GovWorks contacted us, I know the creator of this product and the CEO of the company. He came through TriTech. So I worked with him on the CAD side through the TriTech company since 2012. And Scott said, I think that YCOM would be a great early adopter, and you would give us feedback and help the product be better, Patty. We've been early adopters on the CAD side many times. And that was what we attached to the variance, was we are proficient in being early adopters. The feedback and the work that we will put into making this product better will help all communication centers, not just in Oregon. And if the state of Oregon would approve the variance, we would provide all of the feedback that we have to other centers as well as help them onboarding when and if they adopt the product. Our hope is that OEM will eventually see and free up the funding for year-over-year subscription. Right now, that isn't the promise, and I have not asked for a variance for year 2. Our deal or our agreement was that YCOM would receive the variance, become a pilot, try out the product, and then we would go from there. Because we accepted being an early adopter, GovWorks offered us $35,000. It's a set fee, and it will never increase. So $35,000 annually for the service for YCOM is our contract with GovWorks. We can discontinue at any time. I do believe that it has proven its capability and worth. I do see it as essential to really understanding and truly knowing the performance of our center. Also, in addition, I didn't mention, it provides feedback directly to the dispatchers. They each have logins. Every evaluation that it has done on me as a dispatcher, on David as a dispatcher, they've received in their inbox with the score and those type evaluations that you're looking at. Here's what you did great. Here's what you could do better. Here's what you missed. Here's what was out of compliance. And our dispatchers are receiving that. Anyway, that is $35,000, and I've coded it to the professional services line for this subscription and evaluations.
And then I have a non-budgetary follow-up question on that. How does that work around privacy if it is getting everyone's name, address, health information?
You will.
And it's teaching machine learning
I
that.
appreciate that. So GovWorks is utilized through the GovCloud. We own everything. We are not sharing information outside of our network, outside of our quality assurance program. And you will notice that the individual copies that you have today have nothing identifying callers, nothing identifying personal information, CGIS information, and it's all contained within us. So nothing gets distributed out.
I appreciate that.
I appreciate your question. Thank you. Any other questions? Okay, and then moving into hosted technology. So I'm just going to go over this very quickly. If you're a budget committee member and aren't familiar with this project, please do ask any follow-up questions that you have. This is Paramount project that is a multi-year project to replace. YCOM is partnered with our law enforcement entities, Yamhill County Sheriff's Office and the City of McMinnville's Police Department. And YCOM entered into an intergovernmental agreement in which we are working on an RMS upgrade project. So RMS stands for Records Management System. It's law enforcement records for the 4 entities that we have. This is a multi-year project. Again, because it is part of the public safety suite, it's hosted on YCOM's network infrastructure. YCOM is the customer of record. And then by the terms of the IGA, I serve as the coordinator of the RMS upgrade project, and YCOM is providing dedicated project management as well as tasks and rules through this project. And then I can tell you that every member of my management team, there are 4 of us, as well as some of my CAD team members have roles and have work tasks daily, if not, well, actually daily on this project. It is slated to go live in 2026. It is taking a lot of the bandwidth as designed for the expertise that we do have in projects of this size and of this nature that we are supporting our law enforcement members to complete. I do want to point out the bottom of this as far as this presented budget. It is important this year that when you get to the beginning balance, one of the things that we typically have not focused on, and we need to make sure that we are focused on, the difference between beginning balance that represents money that's encumbered and money that is operationally available to be spent in the next year. So the beginning balance that you're looking at, that $884,000 in the beginning balance line, does include over $200,000 that will still be spent in the RMS project. And that's due to contractual requirements that are attached to invoicing that will happen in fiscal year 26, 27. They could also happen some prior to the end of this year. Might mean that we won't carry over as much. So as the project milestones are completed, I will be billed. I will pay that bill out of the 885 line, and then we will receive the reimbursement from half from Yamhill County, half from the City of McMinnville, back into your 34168 line on the revenue side. So they do work in tandem, and they provide for the revenue and the expense to come out of our budget. So when you look at the 884,000, that number operationally should have just dropped to 684,000 as far as the beginning balance with that information. Are there any questions? Okay. Questions online? Okay. All right. I'm not going to go into the actual evaluations from Comms Coach, other than one more note. Again, here it would be the equivalent, and I didn't put it in your packet, the equivalent of a cardiac arrest, and this would be the equivalent of a save, at least in the first 3 benchmarks of that chain of survival. So Madison Varel was notified that she scored 100% on a cardiac save, where she gave instructions to position she recognized the sudden cardiac arrest. She gave positions to position the patient, and then the first hands-on chest compression was received in under 120 seconds, and the person kept them going. She provided reassurances to her caller, the entire package, until first responders arrived. So she already has received that information. She had this call during the month of March, and she doesn't have to wait until February of next year for us to go, this was fantastic. She also did not have to wait until the month of April, the month following, when Darcy started doing her evaluations for EMD. That day, Maddie knew she scored 100% on that emotional call. So that is second to none in employee feedback on performance. Are there any questions? Okay. Moving on to page 5. I'm not going to spend a lot of time reading the geographic information systems section over on the left-hand side of the page. The things that I do want to point out to you is that Oregon is well underway for their next generation 911 project. The business case is due to be approved along with the budget. So the business case has been approved. The budget is due to be approved anytime, which means that the 911 program will be full steam ahead with acquiring core services, which means they're replacing legacy 911. So legacy 911 has camera trunks. There's fiber that runs under the ground, and we're talking about call routing by location in the future. So today, did you know that if I live in Oregon, or most often what happens to us is someone lives in Tennessee and they come out to wine country to vacation and they dial 911 with their cell phone, it may or may not come to me. It might go back to their provider because they're on a VoIP system in Tennessee, and then Tennessee or Washington State or Florida is sending that to us. Next Generation 911 provides the core services to go to the device that is asking for 911 and ask that device its location. And then the system has one single geographic data, and I'll explain that a little bit more, database that gives all of the locations for the vicinity of that phone and dynamically knows to route that to YCOM. So today, the legacy 911 system was created when people had telephones in the wall of their house. So Patty Sowers went out and got telephone service, and I was assigned a number. And on the back end for 911, for enhanced 911, a database was created. It's called Master Street Address Guide. And the database said, Patty Sowers has a telephone number and she lives on this road. And so when calls happen on that road, assign emergency service number 234. So that phone would call, an enhanced 911 would look at a database and say, oh, we know where that phone is because it's in this tabular database. So we route the call to YCOM, and that's how that worked. Well, as soon as we took our phones and unplugged them from the wall and started walking around, we did not know the location of callers. And that became very, very difficult. And private industry, of course, outpaces government in a multitude of areas. And caller location services was one. Then came phase 1 wireless. And phase 1 wireless told YCOM, well, we don't know where the caller is, but there is a tower off of Booth Bend Road, and that's where their cell is hitting. And then came phase 2 wireless, telling YCOM the tower is out off of Booth Bend Road, ask it to rebid, and we would press a button, and the button would cause the network to go back and ask my phone where it was, and it would give us a location within 50 meters of mistake area. So dynamic call routing involves preparing across the state and really across the nation based on NENA, Next Gen 911 data models. We have all of these data providers. So Tim Vandewally is a GIS data provider. And he is busy and has been busy for the last couple of years working in tandem with the state of Oregon, converting all of those tabular road center line address points, police, fire, EMS response areas, PSAP boundary layers, that picture on the second page, all of those things into GIS data so that when this phone tells 911 where it is, the system in the future is going to just route that to the PSAP that is closest to handle that call. So we are on the verge of that. The 335-33 line provides for direct reimbursement of all of his time provisioning our GIS boundary layer. And the biggest work area right now is, I just said, not just our area, but everyone in the state of Oregon. So we need a statewide GIS layer. We have one now. For the state of Oregon, Al Petzold is the data steward for the next generation 911 for our PSAP jurisdictions data. And now what Tim is going through is he has to meet with data providers from Washington County, from Tillamook County, from Polk County, from Clackamas County, and they are snapping, is the term, their lines. Because maybe YCOM said, well, our line ends here, and it was 2 feet different than what Polk County did. So we have overlaps and we have gaps in what was a tabular system. And all of this data needs to be snapped to the exact location so that seamlessly, if that phone is in that overlap, the system eventually will know where that call needs to go. So the one thing that I will say, and this goes right down to our member agencies, my phone does not know if I need an ambulance or if I'm in fear for my life or if my house is burning down. And as long as police, fire, and EMS agencies use different dispatch centers and overlap county boundaries or dispatch agency boundaries, we will have the need for calls to be transferred. So Amity Fire District, but Southwest Polk Ambulance, one of the 2 centers needs to answer that. Today, Amity Fire District is answered by YCOM all the way through their district and transfers that call to Southwest Polk. And actually our agreement is we take care of the patient and we notify Southwest Polk for the ambulance. But those overlaps will continue as long as those PSAP boundaries are not an exact match to the serviced agencies. Does that make sense? Okay. Let's get into 26, 27. Thank you so much for your attention and time. The beginning balance, the 30101 line. So I just spoke with you about the 200,000 that is contained in there for RMS project funds. The beginning balance also reflects another $100,000 that will be spent replacing required network hardware in YCOM's infrastructure in 2026, 27 instead of 25, 26. We don't have the bandwidth or the time for shipping to be able to replace that hardware during the current fiscal year. That project has been pushed. Quotes will have to be updated. The last quote that I had was $94,000. The low bid, I think, was in the $80,000. So I am considering $100,000 in the beginning balance to be reserved, and that is intended, not operationally available, but will be utilized for this necessary network security change. So it's a hardware project. So when you flip over and we get very quickly into our budget scenarios, that 884,000 has now become 584,000 of operational revenue. 300,000 of it is earmarked for something else. Are there any questions there? Okay. I spoke about the 911 telecommunications tax. So very quickly, of every dollar that's received in 911 tax, 35 cents of that is pulled out and utilized by the 911 sub-account. Actually, and 4% of that goes to the Department of Emergency Management to facilitate the 911 program. And then outside of the administrative costs of facilitating the tax, the accounting, all of that, the distribution, the management by OEM, then there's a distribution out to YCOM. You will see that provided for in the 33518 line of our budget. I'm projecting that that number will be decreased by 5,000 next year. However, just today, I did receive a distribution, YCOM's distribution. It was about $3,000 higher than I was expecting. And we did have, excuse me, had a monthly call with OEM last week that they did say that they do believe that revenue is going to go up for the next 3 quarters. So if I had a do-over, I might have left that money in there. The reason why I reduced the 5,000 is because we've also been put on notice that 15% of the budgetary authority given to the ORS project by the legislature is eligible to be pulled from the 911 funds. And we were told and given an estimate, YCOM's amount would equate to $5,000, about $5,000 next year of YCOM's distribution that would be diverted over to the ORS Watch Center project. So I had removed that. Otherwise, this has, it came up, of course, we had an increase from 75 cents to $1 per subscriber to $1.25. It has came up and remained steady. So the good news here is, I don't know, I think we may end up being up around that 890 as opposed to seeing a direct impact. We will have funds taken and diverted from our distribution to the ORS project though. Question on that? Okay. So in your deliberations, that is an item that I do believe it will be 885. It could continue to be the 890,000. And the final thing I wanted to say on this section is I mentioned the sub account several times to let you know, because the sub account pays for all of the call answering infrastructure in Oregon, everything that has to do with E911. My backroom equipment, the computers and the workstations for answering the telephone, all of the camera trunks, all of the networking, everything is paid for by sub-account funds. That variance also receives sub-account funds. So in 2025, the state reported $376,262.27 was paid on YCOM's behalf for that infrastructure. That is money that you won't see in the budget. We don't have to come up with that amount of money. We don't have to support our call answering infrastructure that is provided by the 911 excise tax. So that's where you see that. So when 911 centers began talking about that the 911 tax is going to sunset in December of 2029, and we need the legislators to take action to continue that tax, one of the things that we're going to do is tell our story. And if I were telling YCOM's story to the legislature today, I would say 376,000 was paid on our behalf. And thank you so much. Emily knows here I'm going to start coughing real soon. 890,000 was paid for out of our budget in the prior year, but we have a whole lot that has to be paid for locally in order for our agency to actually take those calls and facilitate those calls. So that's what our messaging is going to be, is that the 911 tax as it is today does not fully fund YCOM. It doesn't come close to fully funding YCOM at all. And if it were to go away, locally, you would have to come up with 890,000 from that revenue line, and you would have to come up with the infrastructure costs as well. So we want to make sure that we all work together to get that message out well ahead of 2029's legislative session. Are there any questions there? Okay. Okay, moving into member dues. I just want to note that's where I'm talking. These are the 336, and I put XX because those are 336 lines when you look in the revenue of our budget. Something that I want to point out in these budget scenarios that you've received, those are the only lines that differ across the board, column to column to column. In the personnel costs, those are fixed. In the materials and services, those columns are identical over and across. These scenarios are provided to you based on, Ken and I were discussing, so about, my guess is 3 or 4 years ago, We transitioned, YCOM had always done this. It was a very colorful document. And the director or the budget officer presented not one budget, but 6 budgets to the budget committee, because we rely heavily on how does it impact my individual member dues. And Ken transitioned me over to Patty. You need to introduce a single balanced budget as your recommendation. But what we've also found and experienced is that this committee and our members still want to see, but what are the what ifs if we do? So when I met with him, he said, yes, by all means, present this, go over this document. And then what you need to differentiate is you cannot present a budget that is not balanced. You're not able to do that. So the far right-hand side, those blue columns, those are balanced budgets. Everything else is a scenario for you that ends in a negative ending balance. Those are not my recommendation. So I want to make that clear. I will add that also we did a change following my meeting, and I will explain that change to you. And there is one more budget, the one to the next left of the blue, that is actually a technically balanced budget. And you'll see that the ending balance is about $12,000. And there's no way that in my being could I color that blue and suggest that as something that would be viable to you next year without any other changes that you might make along your decision path. So I did not color that budget blue.
And that was just lower than the 3%, correct?
It was than the 3%.
Well, it shows like the different percentage increases. So the one that was $12,000 was,
This one,
oh, okay.
yes. Now, I appreciate your segue though, because I did also, in the documents that Emily sent out, I'm glad to answer any questions about this one that you're looking at. And it is entitled dues history. It's 01 April 2025 dues history. That was a presentation that was given to the YCOM Executive Board and has been used subsequently many times over the last year. And that is the numbers associated with the why that you're going to read later in my budget message about how the member due structure was adjusted and what numbers they were. And on page 1, you will see actual dues that were assessed each and every year. And it even says in the title, actual in the heading. And if you go to page 2, that was a supposal, the projected YCOM revenue without the dues formula change. So had, and to Rachel's question she just had no action been taken to give reductions to reduce, to go from a 85-15 cost sharing between law enforcement and fire, had no action been taken to take the full weight of the increase of the 911 tax and extend that over to our members in the pandemic years. And then in 22, 23, set a new dues schedule for our members. Had that not occurred, and had this organization continued to take the rates that they already had and set a 3% year-over-year increase to members, that's what that supposal is. And that has came up in many conversations and scenarios over the last year. And so I'm just providing that to you today. I don't have anything to present on this, but I'm glad to answer any questions if you need them. Hearing none, I'm going to move forward then. On that same page, but over on the right-hand side, now we're finally into our expenses of the 26-27 budget, and a few things I want to highlight for you. Your personnel lines do reflect a 2.2% cost of living increase, and a 2% market adjustment across the board. We are a union environment, and we do have a collective bargaining agreement that was ratified for July of 2025. It is current through June of 2028. This is the first time in my career that the collective bargaining agreement also included in future years market adjustments. And that's to show you what the staffing study and our comparators for our dispatch staff were significantly behind. And there's a market adjustment. There was one last year and there is one this year, in addition to the cost of living increase. Is there any question there? Thank you so much. Okay, just a quick note on our health benefits. I'm talking to employers who also have employees with health plans. I wanted to note for you something's different. So when CIS put out their rate increases for cities, so YCOM is under the cities invoicing for their cities plan, all cities for CIS. I don't know exactly how that came about. I think when we were separated off from the city of McMinnville, then we became a cities member for the EBS trust. So the cities were told not to exceed rates for their plans for 13-point-something% for next year. And counties were told 14-point-some% for Regents plans for next year. And I've just told you 20%. Well, CIS has also made plan changes, and I have a collective bargaining agreement that says that YCOM will provide Regents copay plan E with the rider, with the RX rider, or substantially, yes. You just said it and I just, equivalent coverage. That is going to have a different name in 2027. The current Regents copay plan E is getting forklift changed to a 70-30 plan. And currently we provide an 80-20 plan, which the new name, the substantially comparable coverage, our employees will be moving to, we've been not to exceed rate of 20%. So your personnel lines are building in the 20%. We are contractually obligated to continue that coverage until such a time that we change our contract. As an organization of our size, I could, in my request for coverage, say, we're going to offer Kaiser and Regents. What I can't do is for our non-bargaining members, say non-bargaining is going to have this Regents plan and bargaining is going to have this Regents plan. So it's extended to all areas of personnel as an 80-20 plan. We do have a cost sharing that is in play and has been in play for the last several years. And by being in play, I mean we hit our maximum cap of 93% paid for by YCOM, 7% by the employee a couple of years ago. And all increases from here on out will be covered under that cost sharing mechanism. So are there any questions to that? In other news, dental went up 2%. Vision is going up 2%. Our liability lines of coverage, though, did have slight decreases. The only one that I did not change in our budget because we usually get some type of a rebate, and that was from our workers' comp lines, but I've not been quoted on our workers' comp. But we have not had a workers' comp claim in many, many, many years, and I don't expect any type of significant addition there. Okay, there is one new budget line that's called out in our budget. We've always paid for employee assistance services. They've been wrapped up in the lines of coverage for our medical plans through CIS. They also announced that they are pulling out their employee assistant programs, and those will be provided only by optional riders that organizations need to sign up for. So they will have separate invoicing. That has been, I worked with Tara Williams and also spoke with Ken, the county, utilizes the same budget number. And I have pulled that out of the budget. You will see that it has a $251 line item in the personnel lines that represents what CIS has estimated as my cost for January through June of next year. So YCOM will be paying for that one 100%. We had a lot of conversation about that we don't want to put that into the hands of voting on whether or not we want to continue, that it's in our best interest and it's a best practice of a public safety employer to offer employee assistance to our employees. So, questions there? And then finally, the PERS rate for the 25 through 27 biennia was already set. We experienced it last year. There is no increase in the PERS lines other than in which employees we have and were they a tier 1, tier 2, or an OPSRP member. I can tell you we only have one employee on staff who is a tier 1 member. All the rest of our staff do fall under the OPSRP category. I am raising a flag, and I will continue to raise the flag until January of 2030. This budget committee and the board needs to plan for the implementation of House Bill 4045. It established a new classification for PERS called a hazardous position. That was implemented. There were efforts to reclassify 911 dispatchers from today. We are a general service position. We are not police and fire PERS. There were efforts to classify telecommunicators as those public safety, and the legislature did not have an appetite to do so, and instead became House Bill 4045 that was passed. It did go into effect with a projected date of implementation January 1, 2030. So right now, PERS is working on getting everything ready. Telecommunicators and Oregon State Hospital workers who have direct patient contact, and they will have to prove the direct patient contact, will be reclassified 4 hours in service beyond January 1, 2030 in this hazardous position. I would imagine that the rates are going to be adjusted likewise for hazardous versus general. So I don't have any idea what those rates are. I will tell you that PERS has already brought up a website. And if you just search Oregon PERS HB 4045, they update it as they get into it. Who qualifies? Tell me how I qualify. So I've got a 16-year employee. He's not going to retire before this is implemented. When he retires, he will have several parts to his retirement. He will have PERS service as a general member, and he will have PERS service in a hazardous occupation. And that's how that works. Okay, question?
Do you have your tier 1, are they looking to retire anytime soon? You know?
Retirement is on the horizon, but
I'm thinking like the retirement to and work back system.
so that person is me.
Well,
And as of July
didn't know.
15, I know, on July 15 of 2026, I will have been with our organization 35 years, and I'm a tier 1 member. And thank you. So I qualified even as a general member about 10 years ago to retire. We still have things to accomplish together, and I don't have a date.
No, that's fine. And I'm not trying to push you into anything. Please don't take it that way. I just didn't know. I know that through where I work, we've been able to establish people still working continuously for us with that PERS rate going down on the employer side.
The sheriff and I have begun those conversations about what would an administrative retirement through PERS look like and what would that be. And it will just tell you if that were as of July 1, the cost savings to the organization's $50,000. So.
Yeah. Thank you.
Yeah. Any other questions? Okay. Moving on to page 7, and this is the bulk of my presentation, so I don't want you to go, oh, we've got this. Okay. The 26-27 recommended budget does provide increased hardware costs, ongoing maintenance, contractual escalators for software and licensing and support applications, as well as that life cycle replacement that I was talking about that you see in the beginning balance. Notable, there are 3 different funds that you're going to see that have I should say materials and services overall has remained relatively flat for many, many years. The notable increases that you'll see are in 3 different lines. The professional services for the GovWorks project, $35,000 subscription if we don't get a continuation there. $50,000 in the 68307 line, that is the software support and maintenance fees. Those are both contractual cost escalators. We can contain those. What we can't contain is, here's your one-off. And by the way, it was a 16% increase this year. So we do have several annual subscriptions that we don't know what they are until we ask for an estimate, and then we receive a bill, and then we argue, and then we settle on something. So that we have overspent that line for the last several years, and I went ahead and adjusted that 683 line by $50,000 to provide for that. And then also, again, it's got a corresponding revenue line, but in materials and services, you see that hosted technology line. And those are items where I am the customer of record, will be invoiced, need to be able to pay out of that line, and then receive the money back into 34176 line, I believe is what it is. Let's try that again. 34167 line is the corresponding revenue line that we received that reimbursement. So materials and services overall between the 3 of those had a significant increase. Without those, it's very, very flat. Are there any questions? So we do have a hardware replacement schedule that we try to stick to. The hardware that I was talking about for 26, it already has been pushed for 2 budget cycles, believing that we could get more life out of that hardware and that it's still under contract and it's doing well and we have redundancy built in. And the reason why I'm declaring that 100,000 in the beginning balance is we've already been through that process, and we're to a place where the best practice would be to replace that hardware before we start having problems. It's a significant security area of our network. I would be even giving more details. Any questions? Okay. Finally, something that I have never done, and I spoke with Ken about this, and he said, absolutely, you were able to do this. So when we get into the budget, the 99014 line, I don't have that memorized. That is the reserve line for radio and telephone projects and infrastructure. So that's our Zetron consoles, and that is our Vesta workstations. So we upgraded the monitors from what OEM was going to pay for when we did our telephone workstations, and YCOM had to pay for those. We opted for an extra monitor. YCOM paid for those. Our Zetron workstations, those computers are aging. We completed a 5-year, it was called Premier Service Package with Zetron with no eligibility for extension last June, a year ago June. And we are currently, they're working fine. We have redundancies in our Zetron consoles. We have 2 different servers, but we are currently into a time and materials for fixes or breakdowns. And I spoke with Ken and said, what if I take that money out of that reserve? The reserve line has been zeroed. The $140,000 has been moved into, on his suggestion, he said any expense line. How about department equipment? That's that 880 line. It's been increased by 140,000. And what that allows us as an organization, one, is if I need to expend the money for the Zetron, we have to pull it out of that reserve line in order to make it operationally available, or we can't spend it. So it doesn't take away from other areas of the budget, and we have saved just for that. But also on the county side, my administrative phones are connected to the county's Shortel Mitel system. And Shane Hoffman, County IT Director, has been underway and has taken us along on conversations seeking what are they going to do, that system is end of life, to replace that Mitel Shortel system. And we are not restricting ourselves, or we are creating an opportunity for that project to organically come along and YCOM be able to expend any funds that we might. Right now, the item that they're looking at is NASPO pricing for Zoom cloud-based phone. And there is different connectivity that would have to happen to our 911 workstations. We still want to answer administrative calls on those. I'm going to have to, and we are in the middle of, we are already engaged with the 911 program with Motorola and Intrado in a what-if scenario. Will Motorola and Intrado allow Zoom phone to be connected to our 911 telephone consoles? And then what types of hardware and software interfacing do we need to have them play well together? And then the 911 program isn't going to pay for those. They may authorize me to have them both reside there, but they're not going to pay for that. We would have to pay our share. Does that make sense? So in addition to that, I also asked Ken, I said, okay, and with the scenarios and the budget and the bottom line that we're looking at, so I would be reminding everyone that the 884,000 in the beginning balance is separate from funds that are restricted to Zetron radio and telephone that are just underneath it. Last year was $120,000. This year, $140,000. Those are restricted, and you can't spend them unless you pull them out into an operational line. Ken also pointed out to me that I said, so if it's not expended this year and we just create that opportunity in case we need it, can it go back into that line? And he said, yes. And also by board action, it can be utilized however the board sees fit. So that also gives us a little bit more of a safety net when we start looking at the declining ending balance. So earmarked for radio and telephone for future projects that we know are going to happen, replacing consoles, telephone system, but also operationally available for consideration by the executive board on how to use those funds in the future. Does that make sense? Okay. Finally, the right side of that page and the next page explains the budget recommendation. And I can go over that with you. I would hope that everyone has been able to read that budget recommendation rather than me read it to you right now. The bottom line is we're going to go over budget scenarios. When we get to the personnel lines, you're going to see that as a result of last year's budget process, declining ending balance, and member dues scenarios, YCOM was reduced from a 20 employee organization to a 16 at the end of the budget process last year. 2 dispatch supervisors and 2 emergency communication specialists were cut. We went from 13 authorization and funding for 13 dispatchers, 3 supervisors, 2 IT professionals, an operations manager and a director, to 11 dispatchers, 1 supervisor, 2 IT professionals, an operations manager and a director. And the budget that I'm presenting before you moves the dial from the 48 months. I'm going to take you on a path. The 48 months of employee time that was cut to 27 months. So the director's budget personnel lines provides for the restoration of 1 supervisor at 12 months fully funded with full family insurance and all roll-ups. That reflects $157,000 is what that number is. And the recommended budget provides for 1 entry-level emergency communication specialist funded with employee only insurance and all associated roll-ups for 6 months. That would be anticipating hiring in January 1st at $44,000, almost $45,000. And then one entry-level emergency communication specialist funded at employee plus family for 9 months of the year, anticipating that when we close out the budget, appropriate the funds, I will open up that position to hire in October for a 9-month employee. So 4 employee positions were cut. The budget reflects 19 positions, but funded 27 months, not 36 months. That's what you're seeing there. I also see some flexibility and opportunity in that supervisor line, and that's why I went for the supervisor line. It's also the area where if I open that position now, unless it were strictly in-house and still timing-wise, if I open that position today, I don't know that I could fill it July 1, which means that we would be building in a little bit of position savings and roll-up costs into this budget by funding that position. If that makes sense. But also it's reestablishing the organization's intention to have full staffing now and into the future. I'm not asking you to restore 48 months or 4 positions. I'm asking you to work with me in restoring and moving the dial while we also sufficiently fund operations without making very large scale, they're large enough, member increases. With that, I'm going to pause for a moment. If everyone would grab your document that says YCOM 26-27 budget scenarios. I'm not going to read every one of these. I have a couple things on each page. And then we'll relinquish the floor for your deliberations. Okay, so again, it looks like this. Emily's going to put it up on the screen to ensure that our online members are looking at the same document. That is the document. It's entitled YCOM Fiscal Year 26-27 Budget Scenarios. It is legal size document. It's still very small. I'll be looking at you double. So the 30101 line, everything that I've already described to you on the beginning balance has been declining year over year. And we've had many conversations about that. While in the revenue line, it reflects an increase of about $120,000. I've let you know that $584,000 of that would be considered operationally available. So we have had an additional decline in that number. 911 taxes, I've explained that, 335.18. And then of notable, again, the 65,000 in the 34167 line of increased revenue, that is hosted technology. You'll also see the 65,000 in the hosted technology line that I spoke about a few moments ago. YCOM will be the customer of record for Central Square's CAD to CAD interface. It's called Unity. And the $65,000 costs for fiscal year 26-27 are being provided to our organization by Yamhill County Deflection Program. So that is a cost that the deflection program went out and received grant funding for. And this is part of their goals for the deflection program. And I have authorization or I guess an offer from the deflection program to institute the CAD to CAD. This will be direct connectivity for as far as deflection to the Newburgh, the east end of our county. So tracking all of those qualifying events, as well as an aside for YCOM, an added bonus for us. This begins a day when I notify ODOT of a call and OSP of a call, and maybe they're working on PGE of a call without ever picking up a telephone line. It would be my goal to implement this very quickly And then in 2026, come back to you and remind you that our overall telephone calls reduced this year because we shipped CAD to CAD, X many of them, to Newburgh, back and forth, to ODOT, back and forth. But anyway, so the first 2 years of that, we have entered into agreement with the Portland Dispatch Center Consortium to acquire the CAD to CAD interface. It is something that we do have the ability to cancel should the YCOM organization be unable or unwilling to pay or not want to continue that beyond the 2 years that is provided to us. Are there any questions there? Okay. So again, it has been the long desire of the organization at this meeting to see scenarios based on what would require the requirements of the individual members be. So you will see those in all of the columns on the far right. Those do represent at the very top, the heading, the 3, 4, 6, 8, 10, those represent what the increase for member dues would equate to with the numbers down below. Corresponding lines to the 34168 and the 34167 line, both of those have corresponding expense lines. These are established in revenue to be able to bring that money back into our budget after someone reimburses us. Are there any questions? Okay. Moving on to personnel lines, page 2 of this budget scenario document. The personnel lines represent, again, the 2.2% COLA and 2% market increase. The personnel lines represent the addition of 1 supervisor at 12 months, 1 ECS at 9 months, 1 ECS at 6 months, and all their associated roll-ups. The additional cost to insurance, overtime has been trending up, and we know we now have positions filled, so we don't have that position savings that has been subsidizing the overspending of the overtime line. So I did adjust that by 20,000 this year. Today, we still are a center where if a dispatcher is sick, on vacation, out of the office, unscheduled for some reason, the majority, if not all of their shift is being covered by backfill. Most recently, the number jumped way up in the last couple months. I had at the same time a dispatcher on vacation. They bid for those annually the year prior. 1 dispatcher on vacation and 2 dispatchers on paid leave Oregon, which extremely stresses our staffing complement and ability to meet our service level expectation. One of those employees continues to be on paid leave Oregon or out on family medical leave. And so we are paying currently for the overtime of a vacation and that absence. So we do have some overlaps in our shifts. So it's, again, it's not the whole shift or every day of the week, but some days a week and some shifts require 100% overtime in order to cover them. Any questions there?
I just want to make sure. So you anticipate there would still be an increase of overtime even if those additional positions were filled, the 3?
Once we fill those positions, we won't realize the person being on their own, possibly in the entire fiscal year. That would be why. So we've met that intersection where positions are filled, we don't have the cost savings, and we still have the overtime because of people aren't out of training. So currently I have 1 in training of the 11, and I have a trainee actually since the board last met, resigned 2 weeks ago. So I do have 1 opening. Those positions are going to be filled and during the life of their training. They most certainly do have an impact, but they cannot work independently as a communication specialist. Yep. Again, I would just reiterate that all of the columns from the right-hand side past the change should be identical on this document. And all of the totals in the bottom of the columns across the page should be identical as well. This is the total for the personnel lines. They shouldn't change dependent upon how much revenue we're going to bring in. The only other thing that I will say is on the supervisor line, the 42140, that looks a little odd when you say $47,000 to bring to increase from 1 to 2. That was the line last year when the budget committee did some add backs, and it was for anticipated for the collective bargaining agreement. And by the time we got to the adoption, the budget hearing and the adoption, we had ratified the contract and knew that we had those additional personnel lines. They were put in that line since our budget is all one instead of filtered down into Social Security and such. And so that's why they look different. The full cost of the wage and the roll-ups for that supervisor, like I said, is $157,000. That's with guessing that it would be the employee plus full family for 12 months plus roll-ups, guessing on their certifications, et cetera. Any questions on personnel lines? Yes.
And what is the standard for a dispatch center your size to have? What is the standard number of people? Or is there? Just, I mean, is like realistically, there's like, you've obviously, as sheriff would know, there's a standard and then there's what you've got. But what is the standard for that?
They fluctuate. We would have to do a current day study on positions. There's a NINA best practices formula. The last time it was ran for our center was about 10 years ago.
Okay.
That was part of the, Chair Swenson used to talk about Dr. Iomo, and it was part of the study of YCOM. And at that time, his presentation said you probably at least need a couple more. And we were authorized for 13 and 3 and 4 and 1.
Okay. Do you feel like you're fully staffed right now?
No.
Okay. If you had an ideal world, what
that's
would that number be?
That's why I'm in front of everyone going.
Yeah, no, I understand.
Going
In an ideal world, what do you think?
my heart skips a beat under 13.
Okay.
We were understaffed for a long time because the applicant pool was very low and all centers were struggling in filling positions. Now that we've filled our positions, I look at our overtime, I look at unscheduled absences, I look at service levels and service level increases that our members want and go, we're doing okay. And we can't sustain this if we want tenured employees, right? We are high functioning. We are meeting our performance levels. We are meeting our call answering standards. We are doing good work and we are on a sprint and we are juggling. Boy, I don't know. I haven't been asked that and I haven't dared to dream that. My dream is to get back to 13 and 3 right now.
Okay.
And then look to how many more do we need?
Okay, thank you.
Yeah.
I have a question.
Yes.
So looking at page 1, those columns there reflect those incremental increases to partner or member dues based on the percentage increase, right? 3, 4, 5, 6, 8, 10, 12, and
Yes.
so on across the board. Do you have any breakdown on what the individual add backs that you're requesting for in as far as dispatcher positions and the supervisor positions, what those reflect as far as percentage increases to the member dues? So if we were to add back the 2 dispatcher positions that you're requesting, what would be the resulting percentage increase to member dues from that add back? If we added, 1 position, if we added 2 positions, if we added the 2 dispatcher and the supervisor position.
Not part of my presentation, but that is why I provided the information that the 6-month dispatcher with all of the roll-ups with my estimation would be $45,000. one could go and look at the math of how we've increased dues. The total add backs are $253,000. So if you take those out, the requirements for a status quo personnel lines is just over 152,000. I think it's $151,000. Nope, I lied. I didn't lie. I had a mistake. 293,238 is representative of the add backs. Without personnel lines have certain increases of 158,623. The only breakdown that I could do for you by member would be 80% is going to be borne by police, 20 by fire.
Understand that. I'm just looking what the percentage of your overall add back equates to so that, when it comes time to make decisions on add backs, et cetera, we understand what those represent as far as percentages of increase to members.
293,000. And so we would need to look at the dues and what they're increasing. Like if we'll go down to the very first one, the difference in a 3% and a 4% one, that's not a balanced budget, but it collects 30 more thousand in dues. And that's the green number at the very bottom.
Okay.
So the difference in a 10% and a 12% collects 40 more thousand in dues. So you couldn't add the one dispatcher at 6 months. We need $46,000 to do that. So
So
does
status
that make
quo
sense?
would be reflective of almost or roughly the 10% increase, somewhere between the 8 and 10% increase to maintain status quo.
If the budget committee status quo, as far as the personnel lines and materials and services, not status quo as far as the ending balance. This year in fiscal year 25-26, the ending balance was projected at 141,000. Next year, if you did the 10%, the ending balance would be a negative 27,638. So without additional cuts, the budget would not balance.
Okay, thank you.
You're welcome. Okay, moving into page 3, that's where you see in the 61001 line, professional services. I've made that adjustment for Comms Coach. The software license and support in the 68307 line, the $50,000 is for increased rates, contractual requirements. The 69299, that's the hosted technology line that I keep talking about. The 65,000 for the CAD to CAD project that has a corresponding revenue line that will be received. All of the scenarios across the sheet, again, every one of these columns, unless I've made a mistake here, the numbers should be identical after you get past if nothing changes the 26-27 number, because all of those lines should be exactly the same. Any questions there? Moving on to page. I have 2 page 3s. I'm like, whoops. Moving on to page 4, our department equipment line. That's where you're going to see that 99014 reserve radio line has been zeroed out. All of those funds, the $140,000 fund, has been moved into department equipment. I just noticed an error on my part. In 25-26, that number did become $140,000. The $140,000 has been carried over in the reserve beginning balance line. You'll see that the second line down in the beginning balance on page 1. That $140,000, I'm reflecting that we're going to pull it out of reserve and put it into an operationally available line. The department equipment was where Ken suggested. That opens up the ability to, if you use as intended, that would mean the radio consoles, the radio PCs, the backup for this time and materials, replacement. The telephone, if Zoom phones is what the solution becomes and that project happens in 26, 27, as well as if it remains in an operational line, it provides the ability for the executive board to determine what they will do with it in the future if it's not spent for those reasons this year. Are there any questions? So with that, it is not my favorite thing to do by any means of this presentation. Over on your right, for me to present a balanced budget to you, those are highlighted in blue. The balanced budgets on this scenario sheet represent those budgets that the 99001 line ends in a positive at the end of the year. And as you deliberate and you determine where to go next as a budget committee and recommending something to the executive board, remember that this number at the end of the year is what carries to the 303. Let's see. Why don't I have that one memorized? Thank you. 3011. I still didn't say it correctly. Thank you. 30101 line next year. So the hard decision and the deliberation comes with back to Chief Wood's question. If you adopt a status quo as far as personnel lines and materials services, is that a status quo? This year, the projection was 141,000. I'm sorry, in 25, 26, the actuality was we carried over 584,000 in operational money. And Ken's words to me were, Patty, you are spot on. Eventually, if the organization doesn't make an adjustment, you will spend the beginning balance down to zero. And that is money that isn't carried over and can't be made operational for the next year. And that means the mechanism for increasing revenue or making up that revenue that you were short from last year gets incumbent upon the member agencies. I have done my best, and I believe I have presented you with the needs of the organization in 26, 27, and also an ask to move the dial to work at restoring positions. I recognize and appreciate that this is a very difficult decision that you have before you on what you want to do and where you want to go. Historically, I have been a director who goes through all those scenarios and then presents to you, this makes the most sense. And I have presented, this is what the needs of the organizations are, and then this is what my ask is. And am acquiescing the deliberations over to you. I've not, and that's why I and Ken are comfortable with me highlighting 3 to you and not saying, I pick this one and this is the ending balance, because I'm presenting to you the minimum, the balanced budgets, and your decision for what the balanced budget is either to turn one of these white ones into a balanced budget by cutting something that I have not cut, or recommend adoption of one of the blue ones to the comfort level with cuts you make, or with money you move, or with the ending balance as presented that you're comfortable with. For that, I'll take a breath.
Okay.
Are there any questions for me before you?
Chair, I have a question.
Yeah.
With the current vacancy with the recent resignation plus the consideration of add back of 2 additional, with your staggered approach of a 9-month and then a 6-month, we obviously have an immediate from an efficiency standpoint. When you're talking about having folks in training, what makes the most sense for the organization? Does having 2 that are essentially paralleling each other through training, or does having the staggered of a 12-month, a 9-month, a 6-month afford more efficiency? Obviously, it's a capacity issue. You have to have training officers for those new employees. So can you give me your insights on how those align when we're looking at the additional 2 plus the 1 you have, and what I understand the dollars part of it, what makes sense, the efficiency part of it?
So we do have 1 person in training now. Staggered trainees always is ideal for the center because they're at different areas of their training. So even if we have them on shift at the same time, one is going to be doing something that the other one hasn't started yet. So we can utilize the time instead of, we used to say, so both Patty and David are fighting over the next phone call. And so we try to avoid and separate out that. Also staggered, we can take the adult learning style and match it to the trainer. And all adults are different and all trainers are different. But Murphy's Law also tells me that sometimes we have 3 trainees and they all need Talia. And there's only 1 Talia. And so we go, well, we can put them with Patty because Patty is heavy in the law dispatch. So instead of working on fire right now, we'll have her go to Patty waiting for Talia. So the staggered approach is the most ideal, as also for the seasonal work too. So when I think 9 months or 6 months, I'm thinking either more idle time for training, or I'm thinking more busyness level where I can bring somebody on and have them experience fires instead of 6 months post training. And now they're going, oh my gosh. So I philosophically trained on wildfire days and now I'm doing it, right? So
Thank you.
and if I were trying to solve the scenario for you, I might have looked at the money of the vacant position and the timing wise. So we do know in the budget that I've presented to you, that position is funded. I don't have it advertised today. I do know that I'm aware that I likely could not get somebody on board July 1. So when I look at the bottom line, and as much as it makes me cringe, I go, okay, there's a little bit more that we're going to have than what that number is. But I also go, if 2 more people go out on PLO, there's a little bit more position savings that I have. So we'll still be okay in 25, 26. Remaining balance isn't blown.
Thank you. Before we open for discussion, any more questions for Patty? That was a lot of information. We have a lot of numbers, but thank you. I will just open up for discussion and deliberations. Anyone has initial input?
Well, Chair, I'm not seeing anybody else leading this one off. No, I appreciate the director putting the material together. It's unfortunate that, there are some things that we are seeing this play out in every other aspect of our budgets when it comes to personnel cost, health insurance, PERS. None of this is new information. I just got done with the county budget process. So this is exactly the same thing that we were seeing with collective bargaining and all the other uncontrollable costs that we have. I always tend to lean towards the concern for the employees of the organization and the amount of, I mean, I know that from the board's perspective and in prior executive meetings, there was a point where even vacation was not being approved. And that just compounds over time when we're talking about the decisions about adding back the personnel. So we're looking at going back to one less FTE if we choose one of the options that restores the one supervisor and two dispatchers. We're talking about going back to 23, 24 numbers of personnel. Still one less than what we had in 23, 24 as we head into 26, 27. And so I personally, I'm trying to decide which of the columns, I would make a motion for, because from the board's perspective and in the briefings that we get, the director's updates, I just can't see us even entertaining moving forward without restoring the positions, and the fact that the director has recommended them in a staggered fashion where we're not bearing the full weight of an entire year's worth, where we have start dates in, potentially October and January, where it is a little bit of a rolling start. That's, yes, it's unpleasant, but it's just the reality. This is exactly what we're seeing. And even with our materials and service on the sheriff's office side, every single interdepartmental transfer that I have, from building maintenance to motor pool, went up this year. So I know that we could probably spend the next 4 days here talking about all the other work that's going on with respect to updating the 190 and the dues schedule and how those are calculated, but that's not relevant today. We just have to give a recommendation back to the board. And so if I was, well, I'll leave it at that and see if there's any other discussion.
Thank you, Sheriff. I concur with what you're saying. Patty Sowers, Director Sowers, for your input. Very well put together. We're all on the same board. There's that physics things where you're trying to move forward, but you have to move backwards to move forward. But we need to move forward because I've been a part of this for a while, the discussions, and YCOM is an integral part of all of us for Yamhill County in moving forward. So I agree that we all have our own budgets. We can compare our budgets with this budget, and we're all in the same conversations. But I think that we might all have somewhat of a consensus, and I will leave that as the sheriff did for further discussion on where to go. But I believe we're all in the right room of where we're moving forward and what we need to do.
Thank you. And over here?
Well, I guess I'll play devil's advocate for just a moment. I will be presenting our budget starting tonight through next week. And you're correct. I look around the room here and I know that we're all budgetarily in the same boat, facing the same costs. 16% is not something that I know I could have proposed and get through a process at the moment. And I think that we need to reflect on what individual add backs would look like to not only the center's operations, because it certainly has an impact and hopefully a positive one as we add those positions back, but what they also do to the overall budget decision making. I'd kind of like to chew that a little finer, to have a little better understanding what we're facing and what those things are. I fully understand the staffing and those other arguments. My budget proposal this year reflects an FTE number that's 2 more than what McMinnville PD had in 2015. So no argument for me that we all need more people. It's just, what can we afford?
Thank you. Anyone else with input at the moment?
I would have to agree with you on that. I am a personnel person and I do want to put people in the right space and being able to do their job the best that they can. But we've also got to balance it out, as a 16% is a lot to increase over everybody. I'm just wondering how we can balance that out, right? So from little things like VIBA, if it's in the contract that they have to get an increase, like I saw like that's just one of the things I just saw. There was like a $2,000, I know I don't want to like nickel and dime this by any means. I don't want to say you can't buy pencils or whatever. That's not what I'm here for. It's the big picture, but I think you're right. I think if being able to see what each position might be able to reduce or improve, and then really look at is it going to be a supervisor position that's going to be best for right now, or is it the dispatcher? What would be better for you right now is the only other thing I have.
So I'm hearing some mixed input. So I just want to make sure, is everyone willing to do that little deeper dive into what something below a 16% increase would look at? Or is there anyone that is truly 100% opposed to going anything below 16% increase at this moment without spending some time? Yes? Anyone online? Oh.
Chief Godfrey's hand was held up before mine, so you can go ahead, Chief Godfrey.
I just have one question for the director. From the increases since I've been on the budget committee, and please correct me because I'm likely wrong, but I believe the first year was like an 8%, then a 12%. We're talking about a 16% this year. What is the driving factor in such high increases? I did check some comparables for centers around us, and they were everything from 0 to 5%. Nothing near where we're at. Is it our, and I'm not blaming, by the way, I'm just asking, so maybe we can fix it in the future. Is it our fee schedule? Because those are extremely large increases year after year.
The driver is listed on page 7.
Patty, I don't think your mic is on.
Sorry. The direct driver is the member's fee schedule. I would call your attention back to the presentation that was done in April of 2025. One can review deep cuts that were forwarded over to members in the form of dues reductions in 2020, 2021, a new dues schedule set in 22, 23, and it was something that it was an idea that Sheriff Tim Swenson and I came up with to take the opportunity with the 911 tax increase to pass through some money to the members during the COVID years, everybody's budgets. And we were hearing in February from folks saying, we better not have any increase. And we had good reserves and we had a very strong beginning balance. $1.4 million had been the beginning balance. And we proposed it to Ken. We met and met and met. We came back and said, Dr. Iomo had suggested that we needed to adjust our police and fire contribution share from an 85-15, possibly to a 70-30. He had suggested that the board work on that at some point. And we went, here's an opportunity. We can give a 25% discount to the law enforcement entities, not increase the fire entities to cover that 25% discount. And what that allowed is that our 85-15 formula instantly changed to an 83-17 something. And it's listed. I've got it all broken down in this document. And then the following year, we said, can we utilize the next 911 tax to $1.25? Can we reduce that number, pass that along to members, not hit the fire districts, double whammy, and adjust our member dues structure to an 80-20? And we accomplished that in the next budget process. And we celebrated as an organization because we hadn't hurt the fire members, but that we had reduced dues for a second year in a row to police members. And then 22-23 came, and we still had a very high beginning balance, and our reserves were still holding strong. But we were also understaffed. Positions weren't filled, and that was carryover. And we didn't take that into account. I certainly didn't. He didn't. Neither of us saw it. Our budget officer didn't see it. Our budget committee didn't see it. Our board didn't see it. We had these overages in healthy reserves. And we said, let's get rid of the 3-year rolling average, create a way for our members to be able to project fiscal year over year. And the board adopted a base dues schedule. And again, the law enforcement members had a reduction, as well as the city of McMinnville, the largest member from fire, had a reduction that year. And that was what we adopted and moving forward. And here came 24-25, and I'm still doing the budget. And I look at it and I have a declining beginning balance. It went from 1.3 million the year prior to 900 and some thousand. And I said, uh-oh, we didn't take this variable into account, and we've been spending down our reserves to hold member dues because we were still hearing, hold the dues, we're in COVID years, it's a pandemic. And we did that successfully. And in 24-25, I sounded the alarm in 24 and said, our beginning balance is declining. I believe that we gave too much of a reduction in the base dues, and it's going to need to be adjusted. And that year, I believe if you went back and looked at the minutes of those meetings, the estimation was we probably needed about 30% more. And that is my estimate on the fly, off the cuff today. Because I remember a budget committee saying, well, maybe 3 years in a row of 12%, and then we'll be back on track. And the first year, I think they went with a 10 or an 8, just like you said, Chief. And last year, it ended up being 11.9. And so the organization should be poised and ready if we've been telling our story since 2020 or 2024. But we've also had changes in this board and changes in leadership at all levels of all of our membership. And this story has faded away. But we have spent the last year talking about it and talking about the needs of the organization and this declining balance. Because at the very end of the budget committee last year, I said, please, please, please attack this before we get to next May, because we're going to be in the same place. And we have, the organization did, the conversations have been had, but not the resolution. So to your question specifically, it is the member due structure. It is the fact that our reserves were spent in the pandemic year supporting our members. The beginning balance was not taken into account that it is a one-time savings because you didn't spend earmarked funds. And we have been trying to correct that. We were put on a course that required correction as soon as that was recognized. And all I can say is, man, I wish that the organization, I wish that I would have known, would have seen it in 2020, that we would have immediately corrected when those base dues were set. Quite frankly, the base dues were set too low. And we've been talking about it for several years. And as your director, I completely understand why the organization did not make a huge leap or raise, because your budget scenarios, that provided relief to our members from the YCOM line, but your budget lines have all kinds of lines in them. So it would be like me saying, well, we didn't have to increase PERS this year, Well, we did save a little bit here. So I get that, but the base dues are too low. And so the organization has not went on a spending spree. The estimated extended revenue out to the members to give them cost savings, to get them through the pandemic, to get them through their budget crises, cannot be extended any longer. So I would expect until the due schedule is adjusted and those rates are adjusted, the only other alternative for our organization is to find new revenue, or you're going to be looking at increases because the dues are not pacing to what the materials and services lines, the personnel lines are. So if we don't, then we made a cut of 4 positions last year, and that's our intention moving forward. If we don't turn the dial, then that is our intention moving forward. And that's why in these last 2 lines, I said that decision was a turning point in our organization back when. And the organization, each time we join each other, we acknowledge that those amounts were probably too low. And I can appreciate that this is a very difficult decision for you. In my viewpoint, unless member dues are adjusted or additional revenue is brought into the organization, which I don't have that for you here today, we are going to outpace costs with revenue. And the only mechanism of increasing revenue is to restore the due schedule. So when you look at the things that I said I didn't want to read word for word, I've provided that to everyone here. If we had not given those reductions and done a year-over-year 3%, you can flip that page over and see the amount of revenue that we would have today. We would be talking about revenue. And I certainly can appreciate that 16% sounds crazy, my words. But if you flip that page over and then you go year over year, it's thousands upon thousands of dollars less than what you would have recovered. So in answer to your question, Amanda, you asked me about positions, but I'm going to equate it to money and revenue. I don't know of another center, maybe there's one out there and I'd be glad to ask, that gave such deep discounts to their members when the 911 tax came in. I don't know of another one. Maybe they're out there. Maybe they most certainly did. But, you know, I hear them saying our rates are going up too, our costs are going up too. Thank you.
Brandon, you had your hand up also?
Yes, thank you, Chair. So it's not really a question, it's more of just things to be mindful of. I talked to a lot of my peers, and I know some of the elected officials on the dais have talked to their managers and their budget teams, and there are quite a few cities who are reducing staff. And I think we really need to be mindful of what the optics are if we're increasing staff. Not saying that we don't need to, but we were only really given one option today. And I'd maybe like to see some other different options on how we can maybe mitigate the increasing of the employees with maybe some options instead of just the one we're looking at. And I'd also just like to recommend, and I know, you know, I don't want to get into nickel and diming accounts or certain things, but again, I've talked to all the managers and we've all had to cut back on things and tell our staff we can't do certain things next year. And I'm not seeing any adjustments in M&S to reflect, hey, maybe we can't do this year. Just reiterating that as we, you know, look at approaching whatever we want to bring to the executive committee. And like Chief Godfrey says, this is going on probably 36 or 7% in the 3 years that we've been here together, or at least in my 3 years on this budget committee. I have a hard time voting yes every single year on this, and I think we need to see some give from the director in the budget before we can approve it, because it's going to have a real hard time if we're adding staff and we're not skirting funds where we can for this year, when every other city in the county is doing that. So we just need to be mindful of that with what we want to approve and recommend to the executive committee. Thank you.
Thank you.
Madam Chair, I would like to point out one thing. It doesn't matter when the dial is moved, other than how much it's going to need to move in the end. We get further and further behind. If the number isn't correct, it's all to scale year over year. I would remind the board members present that we've had many conversations over the last year comparing us to like centers or organizations to like organizations. Call volume for Lincoln County Sheriff's Office is similar to Yamhill County Sheriff's Office. The sheriff reported to the board they pay $1.1 million in dues. You can review what Yamhill County is slated for. Marion County Fire Department pays $610,000 in dues to Willamette Valley Communications. The director has given in the form of keeping services and costs and the demands of the members within national compliance, performance, pushing employees, creative scheduling. Our employees today work a combination of 410, 5/8, and 3/12 and a 6, and 3 and 4/12s. The director does supervisory duties as well as the operations manager. Your dispatch supervisor has just a couple hours a week off the console to do her 24 EMD calls. She trains full time. We have trainers that work and work and work. And I am not saying that is not what we shouldn't have done. We've done the right thing. We've done right by our members. What I am saying is we cannot sustain that. And I understand holding the line with reductions and further reductions. And I need to let you know that then the recourse for the organization to try to retain the employees that we do currently have and keep them high functioning is to reduce service levels at some point, because we cannot have them juggle for 12 straight hours. I can appreciate that employees everywhere are facing layoffs. However, this is emergency services, the chain of survival, a mistake, a distraction, a fatigue. It's the same thing that Chief Wood is going to be saying tonight. Because when I don't have backup, they're all by themselves, and that's not acceptable. So when one dispatcher goes down the hall to the restroom and an MCI happens, before they get back in, one person is juggling. That still happens today, many, many hours in the week. Josh Whitrock sat there today and he did his job. He's still doing his job for 12 hours while he trains for 10 of it. His attention is split and he's pouring everything into the job and everything into the trainee. And he's done that for many, many years. So what I can't do is guarantee that performance levels and call answering and overall service levels can remain at what they can if we continue on this path. That's what I can't do. We most certainly can delay hiring, be creative, take a funded position, and how can it best be used? And I think there's room for a lot of conversation here. But the fact of the matter is the dues were cut too much. And while I understand and I accept that's my job to bear the weight of Member Dross saying the director needs to give and the organization has had large increases. You know, the organization has been on a path since 2024 to right something that was a mistake. we should not, we gave a gift that we didn't have to give. And in 24, it became a mistake because we've chosen not to correct it. So what the director cannot do is support the organization continuing to make the mistake and not try to do something different. So that means, you know, what are we doing today that we could not do so that these folks could have a little bit of a break and we could keep our performance levels? Or what can we offload to someone and no longer do? Or where do we find more money? And we haven't gotten those answers, and here we're at the budget.
Thank you. I'm just going to add my personal thoughts. Now, I tend to be someone that agrees with everything that's said. Everything that I've heard, there's truth in that. It's important. We need to recognize that. And I'm also not one that wants to kick the can down the road. I'm kind of known for coming into my mayor position and being like, oh, we need to do something drastic. And I thought people were going to come out with pitchforks and they didn't. I'm still there. But I'm finding issue with the fact that last year was my first year on this budget committee, and we talked about that 190 agreement being updated. And as I've thought about it over the year, I feel like that is the mechanism that is going to do the reset, that could be used in a way to fix that mistake, because it's putting it in writing, member responsibilities and what to expect moving forward. I don't feel like that work has been done to the extent it maybe should have, because we're now at this next budget year looking at 16% to write it. And the story that you're talking about that is true has not been told. And so it just comes as a shock when the story that, you know, I came away with last year is it'll be worked on. Not to say that it's not going to take that drastic increase in revenue coming from somewhere, but you have to systematically change the issue, not keep chasing it with every increase, you know, increasing every year. So I would be in favor of looking at some changes. I feel like the people are most important. The service is, you know, of utmost importance. It's life and death. But more at my comfort level would be to look at, you know, the close to the 12% that we were at last year, where it's not an increase over last year, or even below. But that really means that we do look at this and be a little nitpicky and decide on that. Or someone can make a nomination or make a motion and we just vote on a number. That seems like the two paths in front of us.
Chair, I'd like to respond. Certainly the 190 work group, that has been a labor for those folks involved. And obviously we have the chair of that work group sitting here. I'm confident that everybody wishes that was moving more quickly. But certainly with the volume of organizations that sit around that table to have those discussions, it just is, there's a lot to unravel there. And I tend to take a pretty simplistic view when it comes to these discussions. And when I look at, had we continued on the same course that we were on back in 2019, 2020 or 2020, 2021, and just done 3% increases year over year without passing along any of the additional savings or 911 tax dollars to all the member entities. Had we done that, I would be, or the county would have paid in 2022, $4,000 more than if we did a 16% increase this year. So I look at it as that 16% increase in that column is putting me at 2022, 2023 numbers. if we had just remained consistent. That doesn't mean it's not a lot of money. That doesn't mean that it's not shocking to look at a double-digit percentage increase. But the director is right that something was passed along that all of the future effects were not realized at the time. And I am confident that, I mean, we can discuss 12%, 16%. In the end, that 4%, whatever the difference is, you're just going to see that next year, because I guarantee you that we are not going to realize savings in personnel costs from PERS, from health insurance, whatever else over the next year. And yes, the 190 work group does have that responsibility to be evaluating all of those things. But it's really, when I look at it, and when I've had the conversations with my county administrator, that we would just now be getting to 3 year ago numbers had we stayed on the same course. Like, that's helps give some context to, we are just trying to make those corrections. Yes, it is substantial. Yes, it is a lot of money. But at the same time, like, we are making a recommendation back to the board. We are not adopting a dues increase for all of the membership. That's the responsibility of the executive board. We're just trying to give the board a recommendation on how this committee sees that the board should best proceed when it comes to the organization. And so I will let that one lay there for a little bit.
Thank you. And I just want to clarify, I respect the work that work group is doing, and I just see it as really important to not let issues continue. So I was just trying to amplify how important that having a strong agreement will be, because I think that part of the reason that we're faced with this is just some of the lapse in understanding and the historical, as people change, understandings change, and if we can just start on solid footing. But you're right, in this room, we're just talking about that financial, what we're going to present to the board for them to consider. And Member Godfrey, your hand up.
Thank you, Madam Chair. I concur with what you said, and I just want one point of clarification. I did sit on the 190. It was not our job to recommend dues increases or correct the due increases, just so we're clear. They were more grammatical errors and such. And I do believe, and the reason I say this is not to point fingers, but I'm a huge supporter of having that 190 sit down and actually go through the actual agreement from the front to the end and make change in everything from governance to fees and such. And the reason being is because I do agree with the sheriff. I don't believe, although these numbers are big today, if you look at it historically, they aren't that big. But what we can't do, the way we're doing it right now, is we cannot budget our own budgets to facilitate the needs of YCOM, which I'm a huge supporter of. I'm a huge supporter of the dispatch center. I'm a huge supporter of their employees. And I think they should have the money and the resources that they need to be successful. And we as a budget committee and as a board are not helping that by just, again, as was stated earlier, kicking the can down the road. And what I mean by that is just making these increases, these one-time increases. So I'm supportive of the needs of YCOM, but I absolutely believe that there needs to be a change immediately to the entire 190 agreement and not continue to do it how it's been done in the past, and look at it so that Patty and her staff can have what they need, but myself as a fire chief can justify what I'm doing, why I'm doing, and how. If it costs me $600,000 a year, as Patty said, Marion County pays, then that's the cost of doing business. But I can budget $600,000 a year. My budget's set. It's over. I'm done. And so if we go anything over 15%, that is going to be a hit to my budget that I'm cutting something now because we're at the 11th hour. So I appreciate it all. I support YCOM. I support the money. I've never been against the money but the 190 is absolutely necessary immediately.
Thank you for that.
I'd just like to add one thing, Chair. I fully support the director and her staff and what they do. They are a lifeline to us out on the road every day, and can't reiterate enough how important that service that they provide is. Going into this process or continuing in this process, I don't disagree that we need to right the ship. All of us do. And all of us need to right the ship in the way that we fund our organizations. It's unfortunate that for all of us, cost is continuously outpacing our revenue. It's just a reality in this line of work. I won't disagree that I think that she probably needs to right the ship a bit. I won't disagree with that. I think what I would like is the information and the opportunity to maybe do that righting of the ship incrementally instead of doing it all at once, and having an understanding of how that would play out, what that would look like.
I'll be the unpopular one. I'll make a motion. We'll see where we're at. How's that sound? I'll make a motion to right size the ship a little bit at 15%. And that puts us back to where we meant to be today. That's purely out of curiosity to see where we're all at.
So I'm just curious, are you making a motion to adopt a percentage, or are you making a motion for a straw poll of the
Yeah, well, I guess I don't need a motion for a straw poll, would I? So, yeah,
that's
I'm
why I asked the
interested to know.
question.
I'm interested to know. I guess, yeah, I'll take my motion back. And where are we at say a 15% with if YCOM were who have increased member dues 3% over year starting in 2021? Where are we at with that number?
So not the 16% budget scenario, not the 14, but in the middle is what you're asking. Okay.
Yeah.
I guess I'll start. I would be no.
That's one.
Same. I've already budgeted 12% based on earlier discussions, so I would not be willing to go over more than 12%. And I think if we went 12%, there may be an opportunity to cut about the $30,000 needed to build the reserves to at least get us to next year. And this forces the executive board to finally get something done with the 190 because it's been too long.
I was still doing some math on your previous question. It's not exact, but the 293,000 roughly that represents the restored positions previously cut would be, depending on which column you land in, somewhere around 6.3 to 6.5% of the total budget for the year. It's not broken down personnel and M&S, so I can't tell you it would be such percentage of personnel costs, but of the overall budget, if I do my math correctly, those positions are roughly a 6.3 to 6.5% of the total for next fiscal year.
Would that include the extended costs that come with those positions for training and overtime? And
that's just
is that just your salary and benefits?
That's the cost that were built in here, which was the salary with benefits, and it was a little bit tiered based off of hire date and then full employee plus family or just employee only insurance.
Are we still on the poll?
Yes, go ahead.
I'll support the 15%.
I would have to say that I'm not happy with 15%, just knowing that I got to go and face my budget committee meeting tonight and we haven't finalized anything, but I think I would have to say I don't want to keep kicking the can down the road. So I think I could, wrap my head around 15%.
Me.
I'd say yes.
And each member has a vote. I think it is important, though, to kind of take a pulse on consensus, just so everyone has a
Yeah.
chance to get their opinions out there and concerns.
I think that I'd like to see it, to see what that 15% is going to show me, but right now I'd be a no.
And can I ask, would you, do you have a point lower than that you automatically feel comfortable with, or are you leaning towards the 16 fully?
Sorry, I think it's just a matter of bringing back that 14, 15, 16 double digits is huge. But the other part that I keep thinking is how can we not, and I don't know if this is my position to do this, but how can we not bring this always back to our members? Like, can we bring this back to another way of getting revenue, and how else can we get revenue? Because month over, year over year, 15, 10, whatever it might be, it hits everybody. And is there any other way we can get revenue?
I would love for everybody that's on this committee to be actively engaged with your representatives, because the 911 tax does have to be addressed during the 2029 legislative session, or it will sunset. And we will be trying to figure out how to come up with an additional $900,000. So absolutely engaging right now. I've had multiple conversations with ours, and certainly timing is key when it comes to how they're presenting this and utilizing lobbyists. But without seeing at bare minimum a continuation, if not an increase, this becomes the 35-40% conversation here in just a couple years.
I guess that I was the only one that in his answer didn't provide a percentage range where I would have a comfort zone. So I guess I'll cave to peer pressure and do that. I'm like our city manager colleague online. I'm would be comfortable in the 10 to 12% range, far more than 15, 16%.
If we're just doing the poll, then at a minimum 15, but I'm more on 16%.
Are there any additional clarifying questions that maybe we should get out of the way? I will at any time entertain a motion, but happy to keep the conversation going if anyone else wants to consider something that we could look at other than just picking a percentage point.
Thank you, Chair. Director, I'm just going to ask the question, although I believe I already know the answer. In your preparation for presenting this budget to this committee, you ran every possible scenario of a percentage less than the one that's recommended to get us balanced, and considered what ifs of not filling those vacancies that were cut previously. And obviously materials and service is essentially flat, other than the increases that are also offset by the additional revenue from those programs to pay for those. So when we're having discussions about 10, 12, anything under what gets us to a balanced right now, I just want to clarify that you have already evaluated those, and as the director, those were not recommendations that you felt to bring to this committee.
So I followed everything until the actual question. So you mean other scenarios were not?
Correct. The scenarios you presented to us are the
Okay.
viable scenarios that you feel for the organization.
The only thing that I have not presented that was I anticipated this group asking me, well, what would you do with less? Because I would not be comfortable with the ending balance of any of these budgets showing, because I just reported out on the declining beginning balance. So it's very concerning to me that you might, if you chose the 18% and everything was spent in every line and we had no savings whatsoever, and I was trying to build a budget next year that starts with $92,000, telling you that what you really did was start in the hole by 500,000 because it was 584 last year and now it's 92. That's very concerning. And to walk away hearing members go, we can't keep doing this year over year. Right, but we're doing it year over year because a mistake was made, and until the mistake is fixed, then we can't. We're going to continue doing it year over year. Anyway, so what would I do with less? With less, I would engage with my association, and I would look at converting that supervisor position into dispatch leads that are bargaining unit members that receive a stipend for additional duties that I take off the shoulders of a dispatch supervisor and off the wage, and they get a stipend on their additional. That would be something that moves the dial. We could offload some work that is on a single person right now. It's not. It's on an operations manager that shouldn't be, and on a director that shouldn't be, and a dispatch supervisor. But that would be a creative way that I could utilize some additional funds, but not fill that full position. You know, it's concerning going from a 9-month hire to a 6-month hire because that's not a lot amount of money. It seems like it is, but these are savings. You know, if you adopted one of these in the blue, then I would be coming to the board and saying, I'd like to work with you on what changes you know, thank you for funding the money. But do we want to start on a trajectory that we end our balance with $92,000 next year? No. So again, I opened up with, instead of trying to solve this, I gave you the scenario, right? And the scenario is not changing. So I think a cut would have to be made somewhere. And that's what I have not said where, I think, because all of these are needs. We need 48 months, not 27 months. No, I'm not comfortable with less staff than we had 2 years ago. I'm not comfortable leading the charge, telling people to work harder and harder and harder and harder when they're outstanding, the best of the best human beings. That was great. Do more. You saved 6 people's lives. You had a hand in that. Save 10 or 12 next year or work longer. And they do. Our paid leave Oregon, we had a kind of like a social dynamic because the association said it was going to be extended by a week. And the entire organization of human beings says, oh my goodness, yes. And it also presents a trouble. And the association said, we know that you do overtime, give it to us, we'll tell you who's working. Because that's how much they care. So, you know, I have to give them resources and I have to pay the bills. And if, depending on what the decision is, this group is going to say, Patty, we told you last year not to come back for a double digit. And I'm going to say courageously, I told you last year, until we find that solution, I'm coming back next year. So could we adjust the budget to get to a 12, a 15, a 16? Could you adopt one of these in blue? Even if you adopt one of these in blue, my poker hand says something's got to go somewhere, because I don't want to accomplish your beginning balance next year being $131,000. I don't want to be that director saying we started out with 131 and now I want 4 million more. It'll be 5 million next year. So I appreciate the stress and strain. And I would also say I'm right there with you. I live it every single day as I walk through the center and go, man, they're busy. And I hear somebody say, lunchtime, I didn't eat my breakfast. And I go, and there's nothing I could do for you, because I've even been off the console long enough that you don't want me. There are some calls. You know, I enjoy sitting out there and taking calls. And I am not the best person to do that today. We have some amazing people who juggle. And I don't juggle that well anymore.
Member Dross, your hand's up. You're still muted for us.
We lost you.
Uh-oh.
No audio at the moment. Do you want to keep trying?
Did that answer your question? Okay.
Oh, I'm not going to make the comment. You're okay. Thank you.
Where can I make the most bang? I can work on health and wellness and job satisfaction with Darcy, who's a lone survivor right now, and try to get her a little bit more time off the console with maybe somebody's overtime, so she's not doubling everything. And we keep our overtime what we do. And I would ask this group to support a 6-month employee. So now I tell the employees, we're going to hire our one opening, and we're going to start that right now. And that means we have 2 in training. And about the time that Brody comes out of training or is starting to finish up, I'll hire another one in January, and they see you turning the dial. And that was $45,000. That position in roll-ups is $45,000. But what I would ask, and you don't have to give, I would ask the ability to go back to my staff and say, they understand what we needed was 48 months. And they made a very hard decision, and they got to 6 months, knowing that next year we're going to do something more to change the dial. And we've got a lot of work, because that means that we've got 3 employees to finish their training in the next year. That's a lot of work. So we'll concentrate on that. We'll spend a little more overtime and get Darcy off the console. So I would look at offsetting. Maybe that overtime gets increased by 20,000 and I dedicate. Now, overtime is not ideal. I've just talked about them working more and more and more. But the creative scheduling is already done. So the only thing I can do is compensate someone to get her off the console, or to do more projects, or to compensate someone. So when Alien Days comes in, it's not 2 people sitting there. This week, it will be 2 people. I don't have any event monies in this budget. I only have scheduled and unscheduled absences for family and medical needs. There's no event monies in here. And that is way more than that goes against everything. As I walked away last year going,
Am I allowed to make a motion? Not saying I am, I was just asking the question. Okay, I am. I would motion to approve the 18% increase. Do I have a second?
I'll second it.
I have a motion and a second to approve the 18% increase budget scenario. Any further discussion? Seeing and hearing none, all those in favor, please signify by saying aye.
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 Aye. Is someone else keeping track for me here?
Did you get them all, Emily?
All those opposed, please signify by saying no.
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 We have 6 ayes, 4 nays. And given our quorum, is that motion passing? Simple majority? Okay. So we have approved the 18% budget scenario to be recommended to the executive YCOM board. Thank you all. With that, is there anything else for the good of the order or discussion?
Thank you all.
We are adjourned at exactly 5 o'clock.
Wow.
I did not do that on purpose, I promise. Thank you.
Thank you.